My name is Ramy. I am police officer from Egypt. I came from Egypt here to have physiotherapy because I have injured my pellet is coming from my shoulder here and go about from my back and make injured in spinal C7. My goal is to be better, to that he can be able to walk again or not. But here they improved me that I be independent, that I can transfer myself, watching, doing personal care with myself, and they here doing some exercises, physio exercises to make me more stronger in my arms, and we hope that my legs is coming back again, movement in legs.
My name's Colby Van Leeuwen. I'm a senior physiotherapist at the Royal Buckinghamshire Hospital. I've been working with Mr. Ramy Harb since he was admitted on the early September 2013. He was admitted following a gunshot wound that he sustained working in the police force in Egypt. Then he was transferred here a month later for some intensive rehabilitation. So we appreciate everyone's individual style of learning and individual style of exercising. So we really try and push these programs that are really person-centered, and they focus specifically on achieving their goals. So we're looking at what they need to do and how they're best going to be able to achieve that.
I do hydro. After hydro, I come here. I do physio, some exercise for upper limbs because my upper limbs is good. There is movement in upper limb, my arms and shoulder, and they see me make exercise for strengths. After that, we can doing some exercise on fingers, on head to be more stronger. After that, we can do also again more exercises for upper limbs, and I can sit on the bike to do a little movement on my lower limbs, so my legs and standings, that makes stretching in my back, something like this.
So Ramy has a regular daily stretching program that we run through with him. This is to try and maintain his lower leg tone. So he has a lot of involuntary movements through his lower legs, which makes it very difficult for him to try and reposition or to lift the weight of his legs. So he has a program that he follows quite strictly to try and stretch out all his muscles and do as much as he can independently. If not, he can really instruct the technique, and this is something that we've been teaching Ramy's mum to go through, or to instruct one of Ramy's brothers to go through when he's discharged home to Egypt. Ramy's also been doing a lot of more intense work. He's a young gentleman, so we're getting him to do a lot more high-level sort of gym exercises. So we're modifying it to suit his personal ability at the moment, and just constantly progressing it to try and make it more and more intense. His initial goals were to improve his strength and to try and get some functional tasks completed as independently as possible. Since he's been here, he's improved a lot in his strength and everything else. So his goals were sort of progressed to doing as much as he can himself.
With first injury, I didn't know how to do anything with myself, but now I can do more things with myself. I can transfer from the chair to to the bed, or from bed to the chair by myself. Sometimes I can brush my teeth, washing, put my t-shirt on with myself, something like this. When I go from here, I go Egypt again. I maybe work at police, but not police. That like sometimes I can sit on office. Sometimes do something in office, not in the street like first time.
Ramy's been working with the occupational therapists quite intensely here at the Royal Buckinghamshire Hospital as well. We work quite closely with them too. So basically they've been really pushing to try and get some hand function coming back. Because of the level of his injury, he doesn't have full use of all the muscles in his hands. So they've been trying to slowly stimulate that to come back.
All the staff here of physio is very good. They are friendly. They doing what I want. They know what I want to do, and they do. If something is pain or something like this, they work on it to be improved. They're working on the weakest parts of the body, that to be improved and be good, to be more independent and to be more strong. Yeah, they are lovely and good. I like them.